Assalamu alaikum. Last week, we celebrated World Health Day under the theme Food Safety from Farm to Plate, Make Food Safe. It is a fact of life that everyone, everywhere needs safe food, free from microbes, viruses, and chemicals. But it is also true that in this highly globalized world, what we eat today may have come from the other side of the world. Unsafe food is said to be responsible for over 200 diseases, and foodborne diseases cause 2 million deaths each year. And as consumers, we need to ask ourselves, is the food on our plate safe to be inside our bodies? I'm Zaishan Amir, and this is The Fourth Estate. Tonight, we take an in-depth look into the food safety situation here in the Maldives and other health-related issues. But before we go to our guest, here is a short clip from the World Health Organization shedding light on this year's theme.
Safe food is clean.
It is not contaminated by microbes, viruses, or chemicals. It is safe because the people who bring it to us take care every step of the way to keep it that way, from the farm, fishery, and factory to our plates.
Safe food is important because it keeps people healthy,
Communities productive.
An economy strong, but not all of our food is safe.
Every year, millions of people fall ill all over the world because they eat contaminated food.
Unsafe food can cause disease. Unsafe food can cause disease. Malnutrition and even death. Malnutrition and even death.
We are all at risk, especially children, the old, and the sick.
To keep us all healthy, we must each do more to ensure our food, wherever it comes from,
is grown and harvested, stored and distributed, prepared and served safely.
This means we must know our food and handle it safely.
Provide safe food to communities and manage the risk at every stage, from the farm to the plate.
We all need food, so we must all take steps to make our food safe.
Our guest this week is no ordinary man. He is a public health professional who held key positions in the Maldivian health sector from 1975 to 1994. He has served in a number of positions at World Health Organization, WHO, including as the Assistant Regional Director at the organization's Southeast Asia Regional Office. He also represented the Maldives on WHO Executive Board from 1991 to 1993. He holds a PhD in Health Policy and Management from the University of North Carolina, Chapel Hill in the United States. He retired from WHO in 2013 and is now working as Executive Director at the International Center for Environment Development and Operational Research, Andover, which is a registered NGO seeking to promote health, environment, and social responsibility in Maldivian society. He is none other than Dr. Abdul Sattar Yusuf. Dr. Sattar, welcome to the show.
Pleasure to be here.
Now, to start the show, I want to ask you a quirky question. Are you a health freak?
I don't think so. I'm not a health freak, but I'm a health conscious person. Should we say that? There's a difference.
Okay. So let's talk about the theme for this year's World Health Day. From farm to plate, make food safe. How do you think this theme is relevant to Maldives?
Yes, absolutely relevant, very relevant. And not only Maldives, but I think the whole world, all the population of the whole world requires this adage to be adopted. And for Maldives, as a country that imports most of our food, it becomes ever more relevant. And I think that's where the relevance goes deeper than other countries which produce a lot more food. As you know, we only produce our fish. Not produce, we catch our fish.
It.
And then, of course, we have over time come up with more agricultural activities that have supplemented our meager diet of the past. So that's another story of how difficult it was to get people to start eating fruits and vegetables. But now I think we've gotten to a stage where it's become a part of our life, regular meals.
So over the years, we have arrived at a stage where we have plenty to eat. There was once a time when there was nothing to eat. The common man had nothing on his hands to feed himself, to be free from hunger, starvation, and famine. Now we have learned that unsafe food is responsible for over 200 diseases, and foodborne diseases cause 2 million deaths worldwide each year.
Yes.
In your opinion, how safe is food in the Maldives?
I think we've come a long way. I mean, as you said, I've been working from 1975 to today, in fact. Although I've been in WHO, I still have been working for the country, I would say, because I had the interests of Maldives in my heart, and whatever I did contributed to the concerns of Maldives also. I would say that we have a problem still, but nothing like the old days. As you say, 1975, you're looking at the times when we just began tourism, you know. And at that time, we had hardly any imported foods, right? We had only local foods. So in that sense, there was not much of a problem, but still things like diarrhea, it was a foodborne disease, but not from the food that we brought from outside, but from unhygienic practices that we employed in our lifestyles that made food that we prepared get contaminated through various means, as unsanitary water, bad practices in storing and keeping and cooking food, and also handling food, and bad practices of how personal hygiene is exercised, how water is kept safe. All those things contributed to how unsafe food was. So you'd find in those days diarrheal disease was the prime thing. All the time there would be someone with diarrhea, some island with diarrhea, and we had to be running around from island to island checking on that. And as you know, at that time, 1975, that was still before the time of all these oral rehydration salts. So children get dehydrated, and that can be a tremendous burden on the morbidity and then ultimately mortality also.
Now you mentioned about unsanitary food practices. Are these practices still prevalent in Maldivian society?
I think still there is, to a degree which has waned now, the amount of effort we put to creating food hygiene in the 1978.
It's bearing fruit.
You know, it was at that time, but now, let me say that at that time, it was a tremendous burden to make people aware of the need for food hygiene. You know, diarrheal disease was normal. A child grows up with diarrheal disease. They didn't look at it as a disease. It was a part of growing up. And restaurant sanitation was unheard of until cholera in 1978. And cholera, as you know, was spread by water. We found that out. And that was through contaminated water. Our unhygienic practices of fecal disposal into the ground, which percolated into the wells that we drank water from. So all those things added to the burden of disease that we had. people didn't imagine it was the water that caused it, but ultimately it was. And then you had flies, so many flies, because we are a fish producing country. So all the dried fish, flies was everywhere. Nobody thought too much about flies. Now when you see one fly in the house, you're concerned. At that time you had carpets of flies in the households, in the islands especially. You just had to do this and eat. And so all the fly carried all the feces to the food, and the water was contaminated. So you had a continuous cycle of, you know.
Was it like a vicious cycle?
I would say it's a vicious cycle because it continued to degrade a child's health. We didn't have an opportunity to grow. Now you see children who are 6 foot tall, probably you are also 6 feet tall. You would find hardly anybody 6 foot tall at that time. I was supposed to be a very tall guy at that time. But most people, you'd see average age of Maldivians would be, men would be about 5'3", 4 maximum. And now the 5'3" is a short person now. Why? Because at that time you had meager food, okay? You had very, very meager calories because you just had tuni roshi or black tea or some little bit of hedika.
Very little nutritional value.
Besides nutritional value, the caloric intake was also very small. So all that contributed to low stature, you know, emaciated growth, all that. So now with affluence, we have enough calories, more than we need. That's why you get these big fellows now, right? More than, you know, you have the BMI, which is high.
Yes.
So at that time, you had a lot of problems. And so with the meager amount of caloric intake, you still had the diarrhea, which further depleted the calories that they had. So all that had no chance. So a child continued to have diarrhea. You may be okay for a month or two, again you have diarrhea, so the growth spurt stops, again growth again stops. So by the time you have matured into adulthood, you have lost maybe 2-3 inches, which you should have got if you didn't have these diseases all the time.
Now we're a country that imports 90% of its food, and most of this food is processed food. And processed food is sometimes criticized for having no real nutritional value because a lot of preservatives are added, there's a lot of MSGs, and also there are artificial sweeteners and substances added into it. So what is your opinion on processed food?
Yeah, I think that's true. Nutritional value is not as adequate as it would be if you had fresh and freshly prepared food. But you know, globalization has taken over the world, and better packaging and longer lasting ability to store and keep and transport, shelf life has increased. So that means they had to put in other things into that, which are contaminant essentially, although it may not cause you harm right away, it's an cumulative poisons these are. You have the preservatives, as you say, and MSG. Also, they put sometimes into enhancing tastes of the foods that they have. Those are essentially, people call it carcinogenic, cancer producing over. You have various colors in foods also, which are carcinogenic. So over time, these can have an effect. That's why they say the nutritional value is compromised to a great degree also. But beyond that is the chemicals and that added stuff that you don't need, that has made food so much of a talking point. And you have so much of high fructose sugar in many of those things. So all that also adds to the caloric intake. Most of the sugary drinks that we have, we don't realize it, but you're having at least 4 or 5 spoonfuls of sugar in each of those packets of glass of, you know, juices and Milos and all these things. It's good once in a while, but to have it every day, it adds and adds and adds.
So we should be cautious when we're having
Very much so, we must be cautious. The thing is, the advertising has made a huge impact on society. You know, we are always very gullible. As individuals, we are gullible, believe it or not. Even though you might be educated, the more you are educated, that ego tells you, yes, you have to be different from others. So the advertisers know this, and they say, how much better you become as an educated person, you must use this. While the not so educated people can use something else. But then the adverts entice even those who are not so aware into this. You know, it's very easy, fascinating how the human minds can be pulled into wanting to eat and drink things that are very unhygienic and unhealthy. But still, because it is linked to status, it's linked to power, it links to the image and the coolness of life, you know, an image. The youth like to be cool, so all this coolness comes in there. Just like cigarettes, which is not a food, perhaps. I don't know.
And energy drinks.
Energy drinks,
yes.
My goodness, yes. That's quite
another whole can of worms.
Another one, yes. Oh, that's a big industry. Every day you see a new brand of energy drink. It's no more Effect or Excel, but now there are other things that are taking over, and people think the one that comes later is better. But all these things give you high sugar content.
And the WHO recently issued an alert saying that energy drinks are bad for your health.
Naturally, the whole idea of, I'm sure you've heard of diabetes as a global epidemic now. So in Maldives also, whereas we had very low energy food intake before, now it's high energy intake, which adds to the potential for your liver not being able to process all that. So that can cause diabetes. But diabetes not only from drinks and food, high intake of calories, but it's also stress in society. You know, smoking, all that combinational factors that create diabetes. Depression, yeah. It's the worries, anxiety, everything. So there are so many factors that come into play. So food is a big part of it, but together with the food, there is a synergy that created by the induction of all the other things into our lives. And of course, we can talk about lifestyles, which is not a subject of this. Well, in a way, food is a lifestyle.
Food habits.
Food habits is a lifestyle. So that has changed our whole dimension of how young people relate to food. You know, which imported food is better because nobody advertises the local food. All the imported food is advertised. So we gravitate towards that with the thinking that we'll be healthier by consuming those.
Now, what do you think would be the long-term consequences of consuming unsafe food?
Well, long-term, obviously, is accumulation of all these things, right? You have high calorie, which can cause you diabetes, right? Together with other risk factors, as I said. Then there is the other aspects of obesity. Obesity can do havoc with your nervous system and your cardiovascular system. So you can have heart problem, you can have vascular disease. Those are the huge issues of the future. And we are developing and building hospitals to take care of those, but not taking adequate attention to addressing the causes of these things, which lie in our unsanitary habits, lifestyles and food safety, no exercise, smoking, all this. The motorcycle culture keeps us on the motorcycle all day rather than walking.
The sedentary lifestyle.
Yeah, and the sedentary lifestyle. So you're moving on your motorcycle, but your body is not moving. The motorcycle is moving, so you're not getting any exercise. So imagine how many hours a day you spend on that.
So the machines are doing the exercise, not we humans.
Yeah, the machine is gulping up enough of the gasoline, which are for fun. So essentially we are wasting our energy, which are supposed to be in a country where we think of carbon neutrality. We are perhaps not doing adequately to look at where we can become carbon neutral.
Now, based on your experience and observations, can you tell us some of the unhealthy eating habits that Maldivians still have?
Right now, in the old days, it was not an unhealthy lifestyle, but because of the lack of food, we had to eat whatever we had, right? Which was rice and garudia. That was all what we had.
Fish soup.
Fish soup, yes, that's right, garudia, fish soup. Fish soup is a very good thing, but not as a supplement, not as a main thing. It's good to gulp down, it tastes good, it can be a good mix to the rice, but in itself is just a soup only, right? But and then we had other things like yams and breadfruits, coconut honey, coconut scrapings, and dried fish. These were the ingredients that we used in our food. We never had rice in the old days. Old days meaning not our time, but our great-grandparents' time. Perhaps we didn't have rice as a staple. We used to have breadfruit and yams as a staple.
Very austere meals.
Yes, very, very austere. But that's what was available. You can't have anything that's not available. Then, of course, rice was the purview of the better off families. And so that upward mobility that rice brought was also the enticement that was for building up yourselves to a higher state in society. That was what made you eat those things. Just like now, I remember in 1970s and 80s, having butter and jam was a great thing because that shows your affluence. You know, the ordinary people didn't have butter and jam. But butter and jam is not a good thing to eat regularly. Once in a while it's okay. But I'm saying what you can buy for your money makes us become, in our minds, what we want to be. So the kinds of food that we eat now, sausages and what else, pizzas and all these things as a regular meal, or you have fried rice all the time, spaghetti and, well, spaghetti I don't think is such a, but the thing is eating it all the time, varying it with good food, and sometimes go on a binge, you know, it's okay once in a while. But
to have a cheat meal.
To make it a regular, or burgers, some people just cannot get off burgers. So these are very high calorie stuff. Your body does not need that much really. It's a very efficient machine, our bodies are. You can live, well, of course if you want to reduce weight, that's what you have to do. Exercise is not going to reduce your weight. It can pump up your heart and your muscles and your blood system. But to reduce weight, there is no way except to control your food. That's more efficient because you eat a piece of cake and you'll have to walk for half an hour to burn that. So is it better to walk that half an hour just because, and you want to eat the cake? You can avoid the cake every day, right? Not every day, you can eat sometime. So you can, in a way, control your appetite. You have to control, which means you have to have your willpower. That you have to exercise more willpower. You enjoy your food in moderate amounts, and then it'll be okay. It's when you lose control of what you have out there, and eat everything you see, and eat too often, then that can create problems.
Now, talking about food safety, another term comes to my mind: food security. Are these terms related in any way?
Food security is more essential in the sense of being prepared for disasters, being prepared for famines, being prepared for the environmental emergencies that we have. You know, the floods and for Maldives it's not such a big thing, but since we are dependent on other countries, let's say a landslide or flood or huge rains and cyclones can decimate big parts of farmland in other countries, which can raise up the price of food for us because we import everything. So in that sense, how do we manage our food supply? That's related to how we can keep the food supply at the reach of the ordinary people. Now, if the food is too expensive, then it's bad for us because then you don't have enough to eat.
Now, as far as food safety is concerned, we have had a number of concerns as of recent. For example, there was a fear that listeria-infected apples were found in our supermarket shelves. So, what do you think is the best way to approach these concerns?
Yeah, I think there are food standards that are established international norms promoted by WHO and the Food and Agriculture Association. There's something called the Codex Alimentarius Commission that brings out standards for foods. right? What are the limits of chemicals, limits of various things in the foods that will be considered as okay for human consumption. You know, it may not be fully okay, but still it will not cause a public health problem. So you can't live in a sanitary environment, you can't live in a globe where everything is spick and span, completely devoid of any germs or bacteria. So you have to live with what we have, but you have to avoid excessiveness of these things. So that's why WHO also has many standards, WHO standards. But this can be adapted in the country to maybe more stringent, or you can relax it a little more, depending on how easily you can monitor and control and enforce these things. So those are there. I think it would be best if the Food and Drug Authority keeps a lot of good control on how much of these foods are contaminated. They have to do periodic and regular checks on these things, on all imported foods. It's a huge job in a country where 90% of the food is imported. And even local produce, now they would do a lot in checking for quality in the meats and the fish we export. These are required by the European countries and the other countries that buy our fish. So similarly, what we give to our public also must be looked at. It's not just foreign export, foreign quality, export quality, as they say. I mean, which means it's a very funny word, because you only make food good for people who are outside this country to eat. But for our own people also, we must have export quality.
Do you think food is safe for our own people? Do you think the regulations in place are effective?
I cannot fully answer your question to the degree that I would like, because I have not researched that. But I think the food hygiene is reasonable. But my concern is the takeover of many of our food establishments by foreign workers. I don't know how well they are screened for the necessary personal hygiene. There could be things like hepatitis that is carried, and various other conditions that need to be monitored. Hygiene standards of washing hands and keeping your clothes clean, the kitchen standards of how sanitary kitchenware are, all these things. Because right now, since you have not asked the question, I would say also that in our country, the urbanization phenomenon also has happened, together with the globalization, our urbanization, which means we have so many more people coming into urban centers. We don't have houses. People are not cooking their food at home. The takeout culture has pervaded, and also eating out culture. Lots of restaurants. Now, we got to have commensurate checks and balances on that, and controls, which is a huge area of concern, because ultimately when you have a foodborne outbreak, the whole nation is affected. Tourism industry can also be affected by that.
Now, in December last year, we had a water crisis, and there was a tremendous concern over the possibility of foodborne diseases spreading, because some restaurants might not have been using safe water to prepare food. So what do you think the precautions should be that we should take when we are dealing with such food, when we are not sure of the origin of the kind of food that we are eating?
Well, I think in situations like that, there has to be a lot of health, adverts and advocacy from the health sector, exactly what to do. I believe that people must have restraint on having food outside or not in a situation like that. But we can have, let's say, water storage facilities, for instance, in the restaurants also. Backup systems there. Even our nation should have backup systems, That's also, because in a country like ours, in Male City is not such a, well, from our own standards it's big, but from a global standard we are very small.
Tiny dot.
Yeah, so So I think we need to make that much effort to make our water systems have backups and electrical standbys. And even households, I think, would have to, building codes will have to require some storage of water in the houses, because an incident like this tells us the potential for some things to go wrong always. We can't live in the security of everything happening perfectly.
We can't have that luxury.
We can't have that luxury. Something will break down. Something will break. That's law of entropy. Well, otherwise, it's very high energy systems which can maintain. And in our systems, you have management issues, enforcement issues, all these things, and logistics, and a place where we have to import everything, and time will be taken for repairs to happen also.
And we don't have enough manpower.
That's also another thing. You have to import all those people. If really complicated and complex things break down, then we may have to import the manpower to rectify those also. So all these things means that we have to think deeper into how we replan our system. Because every moment you can look at it as a disaster, but then you can look at it as an opportunity for planning the future. And I say this because the cholera epidemic was a perfect example of that. I go back always to that because we learn a lot of lessons from that. Now, it was at that time most of the food hygiene, restaurant sanitation steps we took, because at that time people were ready to accept anything we say. Whereas in normal time they would have complained if we said, please net your restaurants, you have to wear your gloves, you have to wash your hands, you have to have running water, all those things. But in this moment, when it was urgent, people were dying like flies, in the sense we had about 15,000 cases of cholera.
Mass deaths.
And 250 cases of deaths. So in a situation like that, it was fear gripping our society. So at that moment, it was very easy, and everybody accepts that. So those moments have to be grappled. And I would say in Maldives also, going back to, let's say, H1N1, the time of bird flu, that would have been a great time to say, people, don't spit on the streets, keep our city clean. But we didn't take that opportunity. So it's very difficult. I think these are the tricks you have to do, or the opportunities you have to say. I don't want it as tricks, but these are the opportunities we have to take in order to get the public to be complying. And they will. And once they know the benefit, they will continue that.
So there's a need to educate them more.
Yes, and policymakers must be aware of these things. They must be boundary spanning for things, to observe things like this, knowing that these things are possible. Where can we make a difference? And when you watch for that, you will get that chance.
We're in conversation with health expert Dr. Abdul Sattar Yusuf. We'll now take a short break and return in a few minutes.
Baby like Anika salivage. 1, 2, 3, 4 piece free. We wouldn't baby like it. But 12 case, 1 case free. Tutu therefore go for the hingamajoma. Baby like Penakorama.
Tirag postpaid and Nangava, Adi I like Singapore ga ufar chutting head the column the first at Hodava. Hatar Befronang Hatar Doge Hurum, Adi Singapore the Mashur Tantam Balwa Levuma Tuata, Tuata Geterega, Night Safari, River Cruise, Gardens by the Bay, Adi Universal Studio Balwa Levunga Furset. Tirag postpaid and Nangawagin, Singapore ga chutting head the Kolava.
Effect, the mental energizer.
And England need to find a goalkeeper from somewhere. Look at that! He's only won it for them! New hero! Extraordinary!
Warab Balak and Visnutrikamaiku Hualeve, Misafataki, Sri Lanka get Farbadumatiga, Pandukureve, Mir Safate. තාසා කංකෙල්ලවානුලා වර බලෑග බන්ධ කුරුමග සවබුන් කොම්ම මීහකවෙස් අක්බර් සෑ මීරුවේ. අක්බර්ගා එවා රයිට් කුලෑග අස්ලකී මිසෑ කොලිටීකෝ ෆ්‍රෙෂ්කෝ උපෙත්තුමක් කුරවේ මසක්කතුගේ නතිීජා. අක්බර් ෆ්‍රෙෂ් අධි කොලිටී මීර් සෑ. न्यूट्रो स्पेशल क्रैकर्स एत बाइक के इतबार होता पावे
वरमीर
न्यूट्रो स्पेशल क्रैकर्स की पैकेट गागिन अदद का बिस्कोदे कुलेवे आगे मीरु बिस्कोदे
वरक कमदा बिस्कोदे
बिंदा बिंदा खाला न्यूट्रो स्पेशल क्रैकर्स. लोनोमेद टोमाटो मीरु के अवैग जैसा
मीरू मीरू किंग गार्लिक चिली सॉस
मीर को फुरिहम को खालेवेनी मिसो सुरेगे
मीरू मीरू किंग टोमाटो सॉस
कुंबे को मिसो से घमक लुदे हम रंगड़ी
मीरू मीरू किंग चिली सॉस
सोसे वेजिया राहे बेसुंजे
मीरू मीरू किंग फ्राइड चिकन चिली सॉस एंजॉय द ग्रेट टेस्ट
किंग टोमाटो सॉस.
Imported and marketed by Miami Traders. Phone 331-8850.
Sena, oba selta nemonita.
Ade kon sel miharos red wave ngabari enhas rupiyak wefari 60 rupiyak kolle.
enhas rupiyak wefari red wave komendana kadiyas. Hahege badloga 60 rupiyak wanatati kiya.
Mari hamba red wave ngabari emi ho mikauga MMS wikanama takati ga gobodogen ekak posnuwe.
eden hama sateka ga wa.
enhas rupiyak wefari 60 rupiyak kolluma red wave majidi maga.
Red wave mart roshani maga.
Red wave plaza sayid kuyak fan maga adi red wave mall majidi maga badai ti baga jeewa 30 rupiyak jama kolla.
Da.
Welcome back. You're watching The Fourth Estate with me, Jaishan Ahmed. We were having a discussion about food safety, which is the theme for this year's World Health Day. Now, you have an incredible amount of experience in the health sector. So I want to ask you, how would you describe the current status of the Maldivian health sector, which many say is in a state of steep decline?
Yes, I think it's a way of whether you're looking at it, whether the glass is half full or whether it's half empty. I look at it as a transitional condition, where a phase where we have to begin to the public, the government system, because I think there is a dual system happening now in our country. You have a private sector and a public sector. Now, these are two entities that have two objectives. The private is for business. I would say there is the idea of curing and providing health services, but ultimately, as any business, it's about profit, right? And the public sector, there is no profit. So there cannot be a comparison of the decline in one and the ascension of another, if that is what I gather. That's why I asked you the question, you know. And we are meaning the health system as the medical system. To my mind, health system is the overall system of public health and medical. See, there is this idea that health is the complete state of well-being, physical, social, and even spiritual. Mental, okay? Now, all these conditions have to be looked at when you're really looking at the total health of a nation. Are we spiritually well endowed? Are we socially happy and contented and sharing and loving and caring? Or you'd like economically, are we better off? And of course physically, which is the thing that most people see. When we are sick only, we say we have come out of health. We are not healthy. But health is not being sick, actually. But the common person sees health as the curing part of disease. When we are healthy, we forget about health. And so we do everything like smoking, no exercise, overeating, all these things. You don't think about health at that time. But then all these create the conditions for morbidity, which means disease. Then suddenly you say health. Now, to take care of health when you have the disease is much more expensive than to take care of the potential for disease when we are well. Most of the time, because we don't even think about it, because if you are well, why think about having medicines and everything? It's only when you get sick you think about medicines. So together with the idea that when you are well, can we keep up that wellness? Why is it that when we are well, we just go on doing anything we want and think that our body will continue to respect our deeds? Or we are not respecting our body by doing that. So that's why the focus to the common man and those of us who are not in the health system always focus on the hospitals. And true, the business sector is thriving because as long as people are sick, you will have business. And so both parts are that. But I would say in the public sector, we need to focus more on people not getting sick, right? Because that way we're going to reduce our costs. And yes, our expansion of our health system has been in the past 10 years, 15 years, or even more, maybe in the last 20 years, focused on hospitals. And that's what I differ as a public health specialist. I differ here as the relinquishment of the public health dimension. In those days when we had TB, leprosy, malaria and all those, that kind of diseases, we had to take care of the germs. We had to go and attack the disease. So once we had diarrhea control, TB control, leprosy control, malaria control, the survival rate of us has increased from 45 to 50 years to 75 to 80 years. Right. Which means we have gained about 25 to 30 years of our life, right? Now that's a good image. Our children dying before the age of 1, which is called infant mortality rate, which has plummeted. I remember when I started work in 1975, it was 130 children dying out of every 1,000 children born. 130 children out of 1,000 children born will die before the age of 1 year, before their first birthday. And now it is only about 9. 120 reduction. This is unheard of. If you look at all our regional countries, they're still grappling with 30s, 40s, they're still. Only I think 2 or 3 countries which are below 20.
So are we doing better in terms of the region?
No, we are doing better in the sense of health from the point of view of communicable disease reduction and survival. But if you want to define it as from the point of view of medical services, yes, we have a lot to gain still, a lot to improve, because this is a very cost intensive process and is a very competitive process where huge amounts of investment has to go to build conditions for taking care of the disease that come through our bad behavior. And the amount of doctors that we have to get, if every patient who comes for a cough and a cold and a pain has to be seen by a doctor because, let's say, Asanda is available. Yes, I can go shopping for doctors, which is wrong, which is immoral, because you are wasting the money that another person could use for a much more disease. Because something is available, we are going and using it to say that money is there, so we go and use it. This is colossal waste. I would say that part has to be improved. I would say hospitals have to be improved to do the things that we need to do. But together with that, we have to work on our public health dimension, on these lifestyle diseases. Things like diabetes, cardiovascular diseases, cancers. We have huge amount of cancers for a population like ours. You know, we are noted for the cancers that we have. It may be a few numbers, but proportionately, we are pretty high up there. So what's happening to us? So something must be done to take care of the preventive aspects of obesity, preventive aspects of smoking, preventive aspects of use of chemicals in the household and in agriculture. All these things, without knowing, they're insidiously working through into our systems. And I have put in my blogs, for instance, that maybe in 20 years we're going to see epidemics of, you know, heart diseases and diabetes and all these things, young people. Isn't that pathetic? So I would say, in one way, yes, you can. It depends on the definition. We always have to go to the definition of health to see whether health is going down. If you say, in that sense, I would say we are down in some and better in some.
Now, you've written a book which is entitled Unsung Heroes, An Island Health Worker's Journey. Now, I haven't read the book yet, but I would like to once I get my hands on a copy. But can you just briefly outline what the book is about?
Yeah, it's good that you ask about it, because I would like to let the younger people in this country know that there has been a lot of work done by the health workers of the past, meaning the community health workers per se, in bringing about, especially in the, as you said, as we had said, on the TB, leprosy, malaria, diarrheal diseases, and the growth monitoring and nutrition of children of those days and the people of those days. Now, I say unsung heroes because that's become a cliche perhaps by now, but still it is relevant in the sense that their work has not been sung, not been credited with the kind of credit one should give them.
Not being admired.
Well, I would say, I wouldn't say admired in the sense of the ego wanting admiration, but recognized, I would say, celebrated.
Acknowledged.
You know, acknowledged and celebrated. And so I thought it is on my part to celebrate their deeds, because I was one who went with them. I was there with them for the 20 years. And
So you were there in the islands,
I was
sleeping with the islanders.
No,
you were
I was not sleeping with the you know, I was not in that sense so immersed, but I did go on many trips. We went on, you know, malaria, spray trips, TB, leprosy.
But there were health workers who did
with the health workers. So we spent maybe months at a time in the islands, visiting every island, collecting all the children and people, blood filming, giving them treatment.
So there were health workers who lived like the islanders did, just to experience the enormity of the condition.
Yes, they had to. It was not for them to experience that we were sent. They were sent to as representatives of the health system to take care of the health problems of the nation. So they had to go in times when they had no health center. Now you're looking at beautiful hospitals, and that's why I say I cannot, because I've seen another end of it, other side of it, to see how difficult, in what difficult circumstances our boys worked those days. And they did a tremendous job. And now, because we have one doctor missing or one medicine not available, our complaints have grown to another dimension. This is a present system, a situation where we have really not really forgotten or are not aware of the potentialities of the past, of the goings on in the past. So it's to celebrate their work that I did that, and it is about one of the health workers. It's a fictional character, but it could be any health worker. I called him Imran, and Imran goes from the time his father suggested that he should go and attend the Allied Health Services Training Center course on the primary healthcare workers. From that time, how he evolved, and I have sort of placed it in the historical dimension of all the events that took place, the cholera, the trips and everything. So it's a good reading for young people who want to know about the health system, or the health professionals who are passing out from FHS, for instance. They should read that to know what has happened before, so that you can then relate to what happened then and carry on from there the message of the prevention, which is very, very important, which has been neglected.
We have lots to talk about, but we are running out of time. So as a final message, what would you say to our viewers?
I would say take prevention as the more important thing than the cure. Cure has to be there, but if you waste your energy, or if you waste your youth in doing all these things that will make you sick the second part of your life, then you have wasted your first part. The body says, take care of me in the first 50 years, and I'll take care of you for the next 50 years.
So we can expect to live around 100 years.
Well, people can live, yes, I think longevity is increasing,
Yes.
but I guess we can still reach to 100 even. So that 50 years is more important. You don't want to be bedridden. And many people are getting bedridden because of the ways we have lived. So getting out there and doing sports, doing exercise, because that's what keeps your muscles and everything in tone, so that the next 50 years will carry you forward. Otherwise, you're going to have wasted muscles and unproductive heart.
So all this is coming from a man who is all about health. So we better listen.
Well, I try to practice what I preach.
Yes. Dr. Sattar, thank you for joining us tonight. It's been an interesting and insightful conversation, and we wish you all the best in your future endeavors.
Well, I wish the Maldives population well, and anything I can be of help, I'm available, I would like to say, in the way of advice and creating more awareness. And I wish you also good luck in the future, and this program good luck in the future.
Thank you very much.
May God bless, Allah's blessings be on our people, and may we have a wonderful Maldives in the future. Assalamu alaikum.
This is me, Zashan Ahmed, signing off, hoping to return next week to discuss yet another issue of national and social importance. Thank you for watching. Have a pleasant evening.